Here I am with Isabel Vasquez, who's a personal caregiver. She spends her days giving to families that need her, and she is an angel to me and my brothers because she took care of us and our father. Thank you for joining me.
Thank you for inviting me.
So, Isabel, you dive into people's lives and you take care of patients that are sick. What drew you to that kind of work?
For me, it's a very nice opportunity to give the people the care they need in those moments, very difficult moments for the family and for the patients. And I believe in God, and I think God is the one that give me the strength to do this kind of job.
Because what you do is really hard.
Sometimes, but you know, the time that I spend with my patients is something that I cannot change for anything else. It's a gift that God give it to me.
What do you want families to know? What's the most important thing that they need to know in regards to you coming or someone else coming to their house and taking care of the family?
What I really like to say to the families is the caregivers, we are there to help, to give the patients the time that sometimes family don't are able to do, and help them with everything, like medication, transportation, cooking, doctor's appointments, and talking.
And also cleaning.
And I like housekeeping too.
And when you say talking, your shifts are 12-hour shifts. Some of the shifts are 12-hour shifts.
Yes.
And so some of the harder shifts are throughout the night.
Yes.
And that's when you find your most intimate time with the patient.
Yeah, of course. Spend the night with our patients. It's the most critical time. Night sometimes is when they more need like care, and sometimes the emergencies happen during the nighttime.
Isabel, thank you so much for doing what you do. Thank you for
You're welcome.
taking care of lives and taking care of lives, and thank you for loving as much as you love.
Thank you for letting us work with the patients.
To have someone like Isabel come into your life and care for you and someone you love takes a lot of courage on both ends. The most important parts are listening, understanding, asking questions, and paying attention to the fine details. If there is someone you love that is suffering, or you just need some help, go to glendaleadventist.com for all the information you need. Welcome back. As you saw in the remote, the personal care attendant, it's a personal relationship. They get involved in the family and they become one with you. I love you, Isabel. Zita, how long are these shifts?
You know, the shifts varies. It all depends on what the family needs. Our minimum is 4 hours a day, and it can go from 4 to 8 to 12 hours or to 24 hours.
So 24-hour care, also depending on what each individual patient needs.
Correct.
Patient or client?
We can call them clients.
Okay, client, okay.
What if somebody just needs a break? You're taking care of your spouse who's had a stroke or something, or you've just brought home newborn twins and you just want to get away for the weekend or a week. Do you provide this temporary service too?
We can do that, yeah. We can be a relief, you know, for the family. It's more of like, am I tired? I want to go shopping, you know, for the day. You know, do I want to leave like 8 hours to go to the beauty shop, go shopping, you know, take care of myself or other things, go to a spa or something. So we can give a relief for them.
And when do you know that home care is not appropriate, that someone needs to go to a nursing home?
You know,
Great.
we work closely with the family, just like what you have said. We work very closely with the family. We work with the doctor, and usually the family member will say, you know, this is getting to be too much for me.
Because
or
it's
for
very
other
stressful.
family.
A lot of work.
So then we will get another service that we provide is a social worker, where the social worker can get the family members all together and decide what would be the best option. Like giving them a list of nursing homes for them to visit.
From what you're saying, though, it's very much a family conversation.
Right.
Because we're already run out of time. Diane, what thing do you want to say to family members at home that need a registered nurse to come by and take care of their loved one? What do you say to the family?
Well, what I say is that we are out there, we are available for you. So if you need help, we are here to help you. We just need a doctor's order, and we can come out and help you with whatever needs that you have.
And also get involved in what you're doing and showing and medicines and the way to administer this and that and do that. Wendy, what are your final thoughts?
My final thoughts is we provide a great service. Just remember to call Adventist Health Home Care Services. We have wonderful staff, and sample of the few staff that we have.
What is that phone number,
And
Wendy?
it's 818-409-8379.
And real quickly, out of all the services provided here in Los Angeles, why Adventist Home Health Care Services?
We are probably one of the oldest agencies. We have the history, we have the hospital, we're part of the hospital system, the department of the hospital, and just what you mentioned, the language, the services, the kind staff, the screened staff, the educated staff, working closely with the doctors.
And
We know this
Fantastic.
we really know this community, and our nurses and our therapists love doing what they're doing to take care of patients in the home.
And Zita, final thought in regards to people that need your services in personal care.
You know, we're more than welcome, you know, to take them if ever they need any assistance at home. You know, we're there for them to help, you know, 4 hours, 8 hours, 12 hours, even with just bathing. Even like for very short hours, an hour service, you know, we're going to be out there. We are very flexible with the hours.
This is a service that you never know when you're going to need it. You could get in a car crash, you could fall off a ladder, you could be in the peak of health and jogging every day, and still, you know, you're one accident away from needing services such as this. So it's really important to know that a resource like this is so close at hand.
Or just need to go to the spa. Ladies, thank you so much. I know. Thank you so much for your time. So, thank you for joining us. Remember, the most important conversation you are going to have is about your health.
Absolutely.
Have a great night. Thank you for joining us, and we will see you next time right here on HEALTHline.
Good night, everybody.